Well, hello, everybody. We have really got a treat today. We've got with us Kim Moser, who is a representative from the 64th District. But in addition to that, Kim is the chairman of the Health and Family Services Committee in the House. And by her training is a neonatal and intensive care nurse. So just the amount of background you've got, Kim, and is really, it's hard to surpass it, especially when we're talking about health in the state in this pandemic we're dealing with. So let's just, first of all, I'd like just to ask you maybe to address what are the one or two things that you're getting from your constituents in terms of questions right now as we deal with this situation?
Right. Well, good morning, Kris. Thanks for having me. It's really a pleasure to see what you're doing, and I love seeing these snippet videos with various leaders in the community. So thanks for having me. I would say that folks are really worried. They're worried about a lot of things. You know, a lot of businesses are closed. Obviously, we all know this. But on the other hand, folks are worried about their health and they're worried about their family. And so we've got this kind of unusual dichotomy of, you know, what do we do to protect citizens? And we've heard a lot about how we protect ourselves, how we prevent the spread of this new novel coronavirus, the COVID-19 virus. And then on the other hand, I'm getting a lot of questions about businesses reopening and how do we do this safely? How do we get our economy back on track? And folks are very, very worried. So in the meantime, you know, we have some support coming through from the federal government and through the state to deal with unemployment and to deal with the paycheck protection programs and really supporting those businesses as best we can while we're trying to figure out how to deal with this potentially deadly virus. It is very deadly for a lot of folks. And so, you know, I'm glad to see that people are taking it seriously, but we do need to help businesses and people who are dealing with unemployment right now. So those are, I would say the unemployment question is number one right now.
And obviously, there are certain things you can do to help bridge that gap for people to reach out, go on a state website, call. And what's your number one bit of advice you find yourself giving in terms of the unemployment side of things?
Right. Well, I do connect folks to the resources that we know we have. That's unfortunately where my ability to get people help stops. I mean, I do connect them and I make phone calls on behalf of people. I've probably had more calls. I know I've had more calls to the Education Workforce Cabinet than I've ever had. And they are being responsive. I still hear from folks that it's slow. A lot of people are still unable to get their unemployment. So we do hear from the governor daily that in his updates that they have hired new staff and they're trying to ramp this up on their end. So I trust that that's happening and that we're going to be able to get people the help they need.
So, you know, unemployment's a huge one. You're getting questions in addition to the fact of small businesses saying, how do we get ramped back up? We need to do this. Of course, we want to do it safely. Just give us some direction. And hopefully we get more and more of that over the coming hours and days. Maybe you can speak to the issue of, you know, especially your whole household is healthcare. Your husband's a physician. You're a lifelong nurse. Your education is all about this. What's a takeaway you've been hearing about the COVID-19 in particular? Other specific points you're thinking, hey, these are takeaways I'd love to share with the community about what we're seeing.
Well, I mean, there are a lot of things I could talk about testing. I could talk about our lack of preparedness on the epidemiological side. But what I think everyday people can do is understand that maybe we weren't paying attention to our hygiene the way that we should. Maybe we need to. We are going to have a new normal in businesses and when we reopen. So I think that we're going to have to continue social distancing. We're going to have to, like I said, really wash our hands and make sure that businesses are going to have to make sure that their employees know what the expectations are, and they're going to have resources available. We're hearing a lot about PPE, the personal protective equipment, and that the I think jury's kind of in on masks, and that it's not a bad idea for folks to wear masks, especially where social distancing isn't guaranteed. So if you're at a store or a pharmacy, it's not a bad idea to wear a mask to protect yourself more than as much as protecting others. There are plenty of people who are asymptomatic with COVID-19, and so they are unknowingly spreading the virus to people who are possibly at risk. And so I think as this goes on, we're learning a lot more. We are really going to be a lot better informed at the end of this, or hopefully, hopefully there's an end soon. It's probably going to be a virus that sticks around like the flu. And so I wouldn't be surprised if we have to deal with this periodically, and we just need to know how to deal with it.
It's a good takeaway. And I think you referred to the epidemiology of things. Is this, from what you've seen in your career, is this epidemiology study, is the work that's being done, are we on the same track as normal? Is it slower? Is it faster? What do you see?
Oh, absolutely faster. And I really credit all of our researchers and our scientists and our healthcare professionals who are, they know what to look for and they know how to really ramp this up. And so I would say that the fact that we're already talking about a vaccine and we are looking at various treatments, and they're expediting, researchers and healthcare professionals are looking at a lot of different treatments, and they're really trying to figure out how to deal with this. And so I would say they're expediting a lot of the treatments that would ordinarily be in pilot studies for a long time. And they're kind of turning the treatment today into studies at the same time. And I think it'll really expedite what we're able to do with this virus. I am amazed at the speed with which all of this is happening.
Well, let's jump to the other side of things. You've been just come out of the most probably unique session in Kentucky's history, at least in terms of healthcare and what you all are dealing with, and when you were in session. Maybe can you speak to a couple of the points that why was it unique? Of course, we know the pandemic's going on, but maybe the changes that had to be made this session compared to past years.
Okay, sure, yeah. Very unusual session. Normally, in a long session in mid-March is when we are really very, very busy wrapping up the bills that have been worked on all session, and that came to a pretty abrupt stop. We were able to still work on a few key points and key issues, and the legislation that we actually came back and passed primarily dealt with the COVID response. And so it relaxed regulations for businesses and healthcare workers, education certainly. And, everyone just had to scramble to figure out what we need to do to make it easier for schools and teachers to function, businesses to figure out how to deal with this, and then certainly healthcare. And so that's what we spent a lot of time working on. When we did come back, we also practiced social distancing. We figured out a way to vote remotely from our offices. We still had to be on the Capitol campus, but we were isolated in our offices. And so that was the first time that the legislature had ever voted remotely. And it worked fine. It worked well. We were able to get past what we needed to pass. And then the budget. I don't know if you want to touch on the budget, but this was a budget year. And ordinarily we pass a 2-year budget. And at the last minute, we just decided that we really needed to go with a 1-year budget this year. We just are not able to project the state's revenue for the upcoming year due to this coronavirus. And we're going to have to take it a step at a time and really see what our priorities are. And we're going to have to come back in January and pass another 1-year budget.
That's a huge takeaway, that the unknown is what's still going to stick with us for a while, I guess, as you're saying, both financially and health wise, while you're trying to make sure it's easy for businesses to still stay operating and get back open, and hopefully help the schools and all the regulations that go around that. So it sounds like you guys were really focused on that. So Kim, in addition to that, are there any other items that you were able to accomplish towards the end of the session at all that would be meaningful as we look forward?
Sure. I mean, there were several big pieces of legislation that we were able to pass, and we dealt with some budget issues that had been vetoed, and we overrode some vetoes. But one of the things that I passed the last day, actually, of session was a simple resolution to establish the Kentucky Emergency Preparedness Task Force. And so what that will do is just put a team of legislators and executive branch folks together to really dig down on Kentucky's preparedness when it comes to states of emergency or any crises. And obviously, we're dealing with the COVID-19 issue right now, and this is a huge public health issue. But we have tornadoes, and we have ice storms, and we have other reasons to need to be prepared. Certainly, I think if we can be prepared for something like this pandemic, then we can deal with anything. But so this task force will just talk to business leaders and small business owners, healthcare providers, hospitals, farmers, anyone who has been affected by this pandemic, and really see what it is that we had in place and what it is that we need to do better.
That's a fantastic idea. Well, and I guess it makes a lot of sense, especially in looking forward while being present with the issues we're dealing with today. So I just want to say thanks for all the time you spent in the legislative session this period. I know your entire family, as I've said, is focused on the health of the community, and we know that you're going to continue to share things with Kenton County and the rest of the community about how we can stay safe. So I appreciate the time, though.
Happy to be here and happy to help. You know how to reach me, and whatever I can do, I'm happy to pitch in. Thanks, Kris.
Thank you so much.